Hi, everybody. Thank you so much for your interest in our webinar on developing a telehealth strategy for your hospital or your health system. Let's get started here. Okay, so I have divided each of the main topics that we'll be talking about today into 5 different sections. Try to keep each of them brief so I can just not have to participate in the webinar for too long. This is a newer webinar for us, so apologies if it goes a little bit over or it sounds a little bit disjointed. It's a new one, as I mentioned, so hopefully you enjoy it and you are able to get something out of it. We're going to start overall with a very high-level overview. So let's begin with some of the more short-term forces as well as long-term forces driving the telehealth industry, and probably some of the reasons that you've joined us today. So the digital opportunity is large, as I'm sure you all know. It's attracting a lot of new players. A lot of those are looking to disrupt the industry and the way that your patients receive care. Traditional healthcare has been pretty late to the game because telehealth has cannibalized profits in the past, and it's been difficult for health systems and physicians to determine where and how to focus. It's been really hard to determine where demand is going to come from and therefore what services you should provide. It's been an uncertain environment in terms of payments and difficult to work out how to get paid. And there was general malaise from providers overall. New entrants saw an opportunity and presented fresh ideas that drew healthcare consumers away from traditional avenues of care. But I will say with COVID-19 and the pandemic, that actually provided health systems with a new way to draw them back into your own telehealth environments or telehealth platforms. But also on that note, I will say that with the pandemic, hospitals and providers were very quickly forced to develop a fast and non-strategic response. Many of our clients really felt rushed to try and find new ways to provide care and also be paid for their visits in the current climate. And there's a lot of uncertainty about how this all progresses going forward. So with that in mind, let's get started with our first section and how to be more strategic with telehealth as we launch into this post-pandemic wave and some of the demand that it's created. So as I'm sure you all know, there are a lot of changes to telehealth during COVID, or as it continues, that crossed over payers and consumer demand. There was a lot of uncertainty, or it remains a lot of uncertainty, about the future of the underlying laws and rules that changed back in March, and which of those might be short-term, what might stick. But there is a general consensus that at least some portion of how consumers have traditionally accessed care has changed forever. The question now is there going to be a healthcare version of Netflix, Amazon, or Apple? And if so, how will health systems prepare for it? How will you design or redesign healthcare delivery to ensure that you not only directly benefit from telehealth and digital technology solutions, but also stay viable into the next decade? So there is no answer that we can really provide here, but one thing we do know is that health systems will need to think bigger than a website to remain attractive to consumers as well as profitable. Your next generation of consumer, regardless of age, they're mobile, they live online, and you really need a fully functional, behavior-driven experience that's convenient in order to obtain and retain patients. So it's a pretty busy slide, but it's an illustrative landscape of some of the different segments that make up digital healthcare and the kinds of things that we're going to talk about overall today. So at the top, you have the payers. Now, the payers are actually currently the largest providers, believe it or not, of telehealth. This is due to the cost advantages that they've experienced because of it. So we're going to focus on these a bit more later in this segment, but in short, companies like United, Aetna, some of the Blues, to just name a few, either directly provide telehealth or have partners with companies like Teladoc and MD Live, who you see below under providers, to give their members access to telehealth services. You have traditional providers and large hospital systems, many of which are actually developing a national footprint through telehealth. So if you think about this, a Cleveland Clinic or Mount Sinai, these big brand hospitals developing a telehealth platform that can go nationwide, they are potentially encroaching on your traditional customer base. These are big national names that for $25 a visit, can be seen by, in inverted commas, a Mount Sinai doctor or a Cleveland Clinic doctor. Mount Sinai offered their virtual visits for $25. Cleveland Clinic waived their $50 fee during COVID, and that's just to name a few. In addition to health systems, you also have retailers entering the space, Walgreens probably being the most diverse and that with the most depth. They offer telehealth through multiple vendors. They have a $79 fee through an app in partnership with MD Live. It's a cash fee. They have a $29 visit with Hospital Sisters Health System out in Illinois and Wisconsin through their telehealth provider, as well as something that is as involved and complicated as a second opinion, which is an $800 fee, cash pay, out of pocket with New York Presbyterian. So again, if you are diagnosed with something and you're feeling like you would like a second opinion, you can go to Walgreens and through their partnership with New York Presbyterian, ask them for $800 to provide you with a second opinion. On top of these, you also have companies like Best Buy entering the space. They've made a lot of recent acquisitions of companies that allow patients to do self-medical scans and in-home monitoring. And then you have a lot of non-traditional providers and manufacturers that recognize that your patients are going to be seeking out convenient care. They're going to be looking for convenience and transparent pricing, and are looking for ways to also play their part in that game. Let's start with consumerism here. And when looking to market to consumers, the questions to ask yourself are, how do I find the patients that are going to use this service? And what service should actually we be providing? So not surprisingly, millennials are the most motivated by convenience. They are nearly 3 times as likely to have had a video visit with a doctor compared to other demographics. These are the age groups that are focused on starting families, getting their career started, and they're also the ones that have grown up with smartphones in their hands. Then you have over 70% of 18 to 44-year-olds saying that they're willing to use technology. You also have seniors, surprisingly, eager to use it for chronic disease management. And again, surprisingly, at least to me, we found that the 65% plus population was almost twice as likely to want to use telehealth for post-op surgery follow-ups or inpatient follow-ups compared to millennials. So historically, you had telehealth as mostly urgent care with an out-of-pocket like the ones I mentioned in the prior slide, something in the range of $30 to $50. This hasn't changed, but urgent care telehealth is really a commodity type service. It's low ROI, a lot of people offer it, there isn't a lot of value differentiation. What COVID has done is allowed specialists to start offering more telehealth services and begun allowing them to bill insurance for it. And where practical, patients have really loved the convenience of all of this. The question we hope to help you answer today is, how do you maximize this opportunity from both a revenue and patient care standpoint? So starting with some of the opportunities, let's look at some of the direct consumer opportunities. Not surprisingly, it makes the most sense to develop programs that specifically cater to the patients that were from the prior slide that have the demographics that want telehealth. They want to be able to drive utilization. They are the ones that are going to be using it and either paying out of pocket for it or have insurance covering it. One of the things a lot of the health systems we work with forget is that your EMR, it's a gold mine of data that can drive significant ROI with very little upfront investment if you're able to digitally utilize patient records and interactions to determine what kind of demographics you should be offering telehealth to, who's asking for it, and how to digitally integrate that into the patient's care and what the patient is demanding. Overall, within your EMR, what I'd be looking at is demographics and disease states that have some of the following criteria. Patients who are willing to pay out of pocket for convenience or value-added services, and we'll talk a bit more about those later. Those areas that actually have reimbursement and also have patient demand for telehealth services. Look for solutions that work with your EMR to drive digital engagement. Lots of these are low-cost solutions that are proven and work great. Another idea that is really slowly gaining traction is e-commerce and driving healthcare OTC and other medically necessary or convenience healthcare-related products, things like you see in the bottom corner here, to drive hospital into the healthcare retail space. So those of you out there that offer health plans or associated with them in some way, one of the things to note is that employers love telehealth. The big payers have really marketed this to most employer groups by now, but generally have partnered with the likes of Teladoc, or some of the payers have brought them in-house. The reasons that employers offer these programs through their health plans and really seem to like it is because of the efficiency it brings to the workplace, on top, of course, of the convenience it brings to their employees. It means that people don't need to take a whole bunch of time off work for simple health needs like prescription refills or allergy medications that they need. This is a particularly attractive option, by the way, for those of you out there that have a health system that is looking to move into the narrow network type space or have some large self-pay employers in your area. So now let's touch on some of the areas where it suits providers and how health systems through their providers can leverage your in-house expertise to market to this section. So before I dive in here, one of the things I will say is that as much as we've talked about the impact that COVID has had positively on telehealth, I think it's also important to mention that there has also been a fairly substantial drop-off in telemedicine visits now that the markets are opening up more. Overall, just over 20% of total encounters were via telehealth in July. That was down from almost 70% at the peak of the crisis in April. So now we actually have, if you think about it, a situation where health systems and providers who ramped up to provide telehealth, virtual care, had to recalibrate now as more patients turn back to in-person appointments. While telehealth use remains above pre-pandemic levels, and much of its popularity is no doubt here to stay, the recent downturn has created somewhat of a whiplash effect. Those of you out there that rush to train your staff and deliver your care virtually and now trying to find a new balance based upon shifting patient preferences and needs. And because of this, there's a good chance that you're going to end up with some empty virtual appointment slots before you can manage to find the right mix between office and telemedicine visits towards the end of the year or throughout the end of the year. So diving into this more, let's look at where providers can leverage in-house services that you already have, and where some external partners might be able to help. So I'm sure many of you know that implementing telemedicine is not easy. To do it well, physician practice or the health system needs to buy appropriate technology. They need to train staff, also need to train patients on how to use it. It really takes time to help an 80-year-old who's unfamiliar with technology to do a video visit. You need to introduce new workflows. You've got questions like, okay, I'm doing a video visit here. It's not in EMR. How do I quickly get over and send a lab test through the EMR or a referral? You need to change clinical schedules. You have document protocols that need to be updated, and so on and so on. So with this in mind, let's talk about some of the different options that you might have. So obviously, urgent care is the easy, low-hanging fruit, the most retail focused, often out of pocket. You don't even need to worry about insurance. It covers a lot of the common complaints that are easy to diagnose without having an in-person visit. However, this is a competitive environment with really low ROI. But if your health system doesn't offer this, if it doesn't cater to this driven millennial market, you're really at risk of, future downstream services if you don't have this at the entry level. I would say that value-based care is really where the opportunity lies. Health systems with value-based care improve patient care, they manage existing staff and expertise to drive better returns on your at-risk contracts by doing things like reducing readmissions, providing chronic care management. In this area, for the pharmacists who are on the phone today, we've seen a lot of success for both reimbursement and patient care improvement with pharmacist-led programs, particularly in segments like diabetes, cardiology, and other chronic care conditions. As mentioned, it's really helped drive higher provider billing with these additional services. And how it's worked is, the physician has seen the patient and then done a telehealth transfer over to an RN or a pharmacist to continue the visit with medication therapy management, chronic care management, as well as other services. Specialists are mostly new to telehealth game in general, but it is one area I would say where the rural market has really led, mostly because they've had to find ways to provide specialist care in regions that were underserved. COVID has driven a lot of other specialists to enter the market. It's difficult to predict how many of them are going to keep providing these services with an uncertain reimbursement environment. So now, moving on to the payer area, what I'll say here is it's really great to offer these services. It's great if patients want them. It's really convenient. But if and when the COVID emergency telehealth patients go away, let's look for areas where you can still get paid, where you can drive ROI. And, this is where we'd encourage you to focus the most. That's how you expand your payment pool so that you're not only getting the traditional type of visit payment if they stay, but also leverage other options to expand overall revenue while improving patient care. So let's start by looking at revenue growth or revenue retention in a lot of cases, and some options that we've seen hospitals and health systems have a lot of success. So believe it or not, one of the biggest areas where we've seen success is out-of-pocket payments. Patients, particularly in high net worth areas, who are happy to pay out-of-pocket for concierge-like services that involve telehealth. So, for example, pregnant moms, we've seen people pay between $99 to $150 a month to have the ability for, a clinical staff member at the OBGYN regularly look at their fetal monitor, their remote fetal monitor for baby's heart rate. For those of you that are there, like myself, who suffered from preeclampsia and had to take her blood pressure multiple times a day, having somebody look at my blood pressure, keep an eye on it along with me while I was on bed rest would have been a huge convenience and probably saved me daily visits to my provider when I was pregnant. You have mums who love the service, especially those that have a high-risk pregnancy or are concerned about baby. Additionally here, a lot of these moms are looking for OTC product-type recommendations that can be managed through an e-commerce platform. One of the more creative ones that we've seen is a OBGYN practice that when a mom makes her first semester maternity appointment or pregnancy appointment, she, through the EMR, is immediately sent a text with a message that says, hey, thanks for making your appointment. In advance of your appointment, if you haven't got the book, what to expect while you're expecting, it's something that, Dr. Smith really recommends. If you'd like to purchase it now, click here or go to your, Amazon or your local bookseller. I would say that 70% of the patients who get that text click the link. Of the 70% that click the link, about 30% of them actually purchase the book through the physician, delivered them to them, in a couple of days in an Amazon-style manner, and the provider's office actually keeps a profit from that sale. You also have aging in place seniors. Telehealth wellness oversight is something that a lot of caregivers, particularly those who aren't close to their parents, are really happy to pay for. I would say that this has really been driven much higher in the current environment where seniors are advised, to not go out too much, knowing that, mum or dad's being taken care of and have somebody checking in on them remotely can provide huge peace of mind. I've seen this at anywhere from $50 to $250 per month. Then other big areas like oncology support, virtual telehealth visits with oncology product experts, advice of people that will conduct a virtual concierge service and able to help the patient with anti-nausea products to help them through chemo, lotions and comfort items to radiology, and really just provide product advice to them as an ancillary add-on, or for those of you with oncology boutiques or oncology-based OTC sales available online, another real attractive area for this high-value patient group. When you talk about sort of moving on now from OTC type services or products and concierge services, moving back now into the regular payer environment that we're all mostly used to, you have CMS temporarily allowing more than 80 new services to be conducted via telehealth. You have commercial payers that have mostly followed suit. The big question is, how temporary will this be? And until we know more here, there's nothing being said right now at CMS. We're just going to leave this in the short-term opportunity bucket. We'd love to see more of it. We would love to see it continue. But until then, we are going to consider it short-term and look for other ways that you can leverage telehealth. One of the big and easiest ways is chronic care management. Now, while not technically telehealth, it is one of the areas where you can easily gain an additional sort of $50 to $150 per patient by utilizing telehealth services. For Medicare patients with 2 or more chronic conditions, CMS really encouraged the use of telehealth for this because of the higher standard of care that they've been able to see for patients. Typical provider that can generally enroll about 250 patients has been able to earn about $125,000 additional to their practice each year. Health systems that we've worked with, particularly by leveraging things like pharmacy, are really able to leverage this much more broadly and drive massive efficiencies through areas, as I mentioned, like pharmacy, central scheduling, and other lower cost clinical and non-clinical areas of the health system. Now, moving on to a more dedicated telehealth or digital healthcare type option, and that's remote patient monitoring. This is massive, particularly as of beginning of this year. CMS have several CPT codes that covers all of the things that you'd want to use devices for so that patients can be monitored. These kinds of devices you can generally get from your local pharmacy, your smartwatch, or even Best Buy, or as I mentioned, if you have a hospital online retail site, be able to sell it through there. Basically, patients use Bluetooth-enabled devices, could be scales, ECGs, blood pressure, glucose monitoring. Medicare will often pay for the device, they pay for setup and patient training, and then they pay a monthly fee for patient oversight. What's great about this is that you can use clinical staff like RNs, nursing assistants, pharmacists to work with the patient on the physician's behalf, so it doesn't have to be dedicated physician time, really leveraging the lower cost clinical staff across a health system for cost effectiveness. Any Medicare patient with a medical condition that can be monitored remotely will qualify here, and we have seen one practice owned by a health system that has 300 Medicare patients that qualify, bring in over $400,000. Actually, they haven't finished for the full year, For the half year, they've brought in over $200,000 on schedule to be over $400,000 by year end by combining RPM, remote patient monitoring, with chronic care management. You have Medicaid also providing some opportunities, but often with restrictions, usually around disease states. So, for example, a lot of them will only cover diabetic patients or pregnant patients. However, one of the things about Medicaid is for those that are covered, a lot of it is actually at really attractive rates. We've actually seen one at $10 per patient per day. So when you consider who the payer is here, it's quite surprising. Definitely something worth exploring and adding onto any existing remote patient management programs that you might have where it makes sense. And in 13 states, you have commercial payers also required to reimburse for remote patient monitoring. So coming to the end here of the presentation, looks like I'm getting right on time. Technology. There is no clear answer here. Here is a snippet of some of the bigger companies, but they are a dime a dozen, hundreds of them offering all different types of platform partnerships, services. I will say that the most important thing when deciding on technology is really to first decide who you're going to be marketing and serving via your telehealth or your remote digital platform, and then working through payers, seeing how you can leverage this technology for maximum reimbursement. Should also look at how this can all work as seamlessly as possible without adding burdensome layers to your EMR, which is obviously an area that you've made massive investments in. Some of these programs here or companies here actually offer services at no cost. Some of them are just service providers who you actually pay, companies like Teledoc, to offer these services on your behalf. There are thousands of amazing tech innovations coming to market, and this is really where we step in. We are product, service, device agnostic. It is our goal to help you find the right solutions, looking at what's most financially feasible, what's best suits technology for your patient base, really everything different client by client. And also, of course, the buy versus build. Do you partner with one of these people or do you build it in-house? We'll say it's very rare that we recommend building something in-house, which takes me to our next slide. And how do you start? You start with a business plan. Again, this is where we help our clients. It's a critical first step. By working with our clients and hospitals all over the country, really help them understand strategically the key components of digital healthcare and where they should be serving. What are your optimal opportunities for your organization and your region? What's the financial feasibility of each opportunity? What's your best payment or reimbursement sources? Where do you see the biggest savings? So not just revenue for digital healthcare, where are the biggest savings being found? And what, importantly, this is the big one, workflow processes need to be in place. What staffing and programs are needed for success? So there is a survey at the end here where you can select if you'd like a copy of these slides, if you'd like to schedule a call to find out some more. We typically offer a service where, if you attend the webinar, send us, sign up for a call. We'll happily, at no cost, talk you through some options, what you might want to start looking at. Or if you want to email me directly, please feel free to do so here. So again, thank you. I hope that the slides and the presentation were able to help you today. If you have any more questions, please don't hesitate to reach out, and have a great rest of your week.